So today's topic is essential fatty acids. What are they and why do we need them? My name is Alisson Molinares. I am the registered dietitian at Maxwell Clinic. And again, thank you so much for taking the time out of your day to come watch this. If you're watching or will be watching this at a later date, thank you for taking the time. I hope that you find this very helpful. So just a few housekeeping things. I will have you on mute. If you have any questions, please feel free to type them into the Q&A box and I will try to get them answered at the end of our group visit. Now, in the event that the internet goes down, we have some technical issues, just hang in there for 5 to 10 minutes. I will try to switch to a hotspot and we can get back to our group visit without any issues. Just hang in there, even if you see the screen go black for a second. I will try to jump back on a hotspot. Okay, so we are talking about essential fatty acids, and before we dive into that, I wanted us to discuss the different varieties of fat, maybe just a quick overview of them so that we can have a refresher, or if you're not aware of what the different types of fats are, we can talk about them a little bit more. So let's start with saturated fats. They are solid at room temperature for the most part and typically come from animal sources. However, not all. You have saturated fats would include foods like butter or cheese. We'll have some saturated fats as well as coconut oil or palm oil would be considered a saturated fat as well. Now, unsaturated fats are mostly liquid at room temperature. Like I said, not all, but they include some like avocado oil or olive oil. There are two different types of unsaturated fats. You have polyunsaturated fats that are sometimes referred to or abbreviated as PUFAs and then MUFAs. So monounsaturated fats, meaning that they only have one double bond, and they will include oils, again, like olive oil or avocado oil, grapeseed oil are actually considered all monounsaturated fats. Now, polyunsaturated fats, like the name says, poly meaning more than one, it has more than one double bond. And there are two different types of polyunsaturated fats, including omega-3s and omega-6, which I'm sure you have heard tons about. So when we're talking about omega-3s and omega-6s, we are talking about polyunsaturated fats. And there are different types of omega-3s and omega-6s, and we'll be diving into those in just a second. So omega-3 fatty acids. This is a hot topic. It has been for a long time. It's very well researched for many reasons. And I want us to talk about some of that research today. I want us to talk about what omega-3 fatty acids are, what are the omega-6 fatty acids as well. So we'll dive into this. So starting with eicosapentaenoic acid. From here on out, it will be known as EPA, and docosahexaenoic acid. Again, from here on out, we'll just be calling it DHA, so you don't have to hear that again. So EPA and DHA mostly come from marine sources, meaning fish, algae, and krill. EPA is a 20-carbon fatty acid, and it has been associated with reducing inflammation and helping with blood clotting as well. Now, DHA is a 22-carbon fatty acid. Like I mentioned, all of these are all unsaturated fatty acids, polyunsaturated fatty acids, like we discussed earlier. And this is a 22-carbon fatty acid, and it is crucial for wall cell flexibility and for normal brain function and development. And we'll dive into that in a bit as well. Now, ALA, or alpha-linolenic acid, is an 18-carbon fatty acid that is mostly used for energy in the body. Some sources of ALA would include your flaxseed, walnuts, chia seeds, just like you see in that picture in front. While again, EPA and DHA will come from more marine organisms like fish. So now, omega-6 fatty acids, you have 4 different kinds here. And like the omega-3s, omega-6 fatty acids also provide a range of benefits, which I know are not talked about near as often as they are omega-3s. Some of those benefits may include that they can help reduce nerve pain, they can help reduce blood pressure, they can help support bone health, they can help lower the risk of heart disease. Yes, they boost and protect, they boost that protective HDL. They may also help reduce symptoms of ADHD, as well as may help treat some rheumatoid arthritis as well. So I know these benefits are not talked about near as often, but omega-6 fatty acids are also providing us with quite a few benefits. Now, when we're talking about sources of a few of these, linolenic acid will come from oils like sunflower oil, safflower oil, soybean oil, corn oil, and canola oils. IRA or AA can also be abbreviated as AA, arachidonic acid, will come from poultry, eggs, meats, and animal organs like meat, liver, and things like that. Gamma linoleic acid will come from various plant and seed oils. And then when you get to the CLA or conjugated linoleic acid will come from, as you see in that picture on the left, meat and dairy. So there's lots of different places that omega-6 fatty acids come from. So it is very easy to get enough omega-6s from your foods, and they're found more easily than omega-3s are. And they are very prominent in a Western diet when you think about all the oils like corn oil and soybean oil that are being used in all of our processed foods and everything that is being made nowadays. For that reason, we'll be focusing a little bit more on omega-3s, but I did want to point out all the benefits that you do get from omega-6 fatty acids. And I want to focus on that, and we'll talk about the importance of having both of them and not just completely dismissing omega-6 fatty acids. So remember that there are some benefits to those omega-6s as well, and it's not about completely eliminating them. Okay, so now we talk about them being essential, and we put them as essential. There's different types of omega fatty acids, not just omega-3 and omega-6, but those two specifically are labeled essential. And essential means that they must come from your diet. That means you have to eat them. Your body cannot produce them. They cannot be generated in the body. So essential fatty acid deficiency didn't actually appear until the development of total parental nutrition. So meaning you're being fed through your veins and you're unable to eat any food, most likely, very likely in a hospital, since you're being fed through your veins. And until the development of a fat-free total parenteral nutrition, that's how they started. They started without any fats. And that parenteral nutrition formulas were able to quickly induce that deficiency. So in 1969 is when they noticed a woman within a few months of receiving total parenteral nutrition, she started to develop dermatitis, and she died 7 months later with profound omega-6 and nearly complete omega-3 deficiency in plasma. So within a few months, she immediately had that deficiency. Again, the formula was fat-free. It demonstrated how essential both linoleic and alpha linoleic acid, meaning omega-6 and omega-3, are. Now, the conclusion was again confirmed that following year. They put an infant again on a fat-free formula and parenteral nutrition formula, and they found omega-3 and omega-6 deficiencies in plasma and in tissues during their autopsy. So that's how we figured out that they are essential. They need to come from our food. Now, they're not all essential. We talked about the different types of omega-3s and the different types of omega-6s. And as you see in the picture here, they're not necessarily all essential. Technically, linoleic acid and alpha linoleic acid are going to be essential. However, the conversion rate from ALA to EPA is low. The conversion rate from ALA to EPA and then DHA is even lower. So as you notice here, omega-6s and omega-3s have a desaturase that they are fighting for. That's a desaturating enzyme that they are both kind of fighting for, and meaning that it's a rate limiting step. The conversion cannot happen as quickly because they're both fighting for it. So the conversion is, again, biologically possible from ALA all the way down to DHA. However, approximately only 0.2 to 5% of ALA gets converted to EPA, and only 1% gets converted to DHA, meaning it is best and very important to consume that EPA and DHA directly. This is where we struggle with wanting, especially as a dietitian, wanting all my patients to be consuming lots and lots of those omega-3s, just because if we tend to consume, and with our Western diet, we tend to consume more of those omega-6s, they are fighting, and that rate limiting step is slowing down that conversion from ALA all the way down to EPA and DHA. And this is why they are essential. We need to have them in our diet. We need to be making sure that we're consuming them. This is one of the few things that our body cannot do on its own, and it needs us to consume it. Now, let's start talking about the ratio because I think that this is where I hear a lot of misconceptions. I hear that it is hugely important to just decrease and get rid of all omega 6s, and that's not necessarily true. Like I mentioned earlier, it's still an essential fatty acid. Now, because it's readily available, we don't necessarily feel that we need to focus on it, and that can be true. But in general, is known that omega-6 can give rise to pro-inflammatory eicosanoids. So eicosanoids are biologically active lipids that, again, are coming and generated from those omega-6s. There are some eicosanoids produced from omega-3s, however, they give rise to more anti-inflammatory eicosanoids versus omega-6, they're pro-inflammatory. So eicosanoids, when they're present in high quantities, they influence various metabolic activities, not just inflammatory activities, but also platelet aggregation, hemorrhage, vasoconstriction, and vasodilation. So those eicosanoids are very important in our body. And though they are very important chemicals, like I said, their excess production coming from those omega-6, that pro-inflammatory, can increase and your inflammation in the body and result in inflammatory disease. So higher consumptions of those omega-3s can protect us against inflammatory disease. But the ratio really, really does help. So we want a ratio that is closer to 3:1 and nowhere higher than a 5:1 omega-6 to omega-3 ratio. Omega-6, like I've been mentioning, still has some benefits. And so we don't want to completely avoid them, but an excess amount of omega-6 and a lower amount of omega-3 can give rise to inflammation. And that's why we really want to focus on making sure that we are not overdoing it with omega-6s and not falling behind with the omega-3s. But it does not mean that we don't need any omega-6. Now, an AA or arachidonic acid and EPA ratio is going to be only measuring the omega-6 fatty acid AA and the EPA. And the desirable ranges for these ratios came about to correspond to the desirable range for your overall omega-3 ratio. So we are not only looking at the total amount of omega-3 that you have, we also look at your omega-6 to omega-3 ratio, and then you look at your AA to EPA ratio as well. Those are indicators of how good this balance is. Now, I always get asked, well, how much should I be eating? What are the current EPA and DHA recommendations? We want to know, well, what should I be consuming? How much? So the current recommendation for EPA and DHA would be 250 milligrams per day. That equals out to 2 servings of fatty fish twice a week. Now notice how I mentioned fatty fish, because not all fish are the same. And we'll go into that in just a minute, but we need fatty fish at least twice a week, 250 milligrams of EPA and DHA combined. That's the standard recommendation. However, that is very dependent on your omega-6 status, your current intake of EPA and DHA, that is dependent on your risk. Is there hypertriglyceridemia, or is there coronary heart disease? Is there underlying health condition that would require you to need more of those omega-3s than if you were healthy with a normal ratio of omega-3. If your omega-3 index is okay, then those 250 milligrams per day may be what's needed. Now, if you are having any of the, any of the risk factors, we would increase it. And that will come down to your clinician discussing this with you. And there are many ways to figure these out. Now, I did add this picture right here on the side because I've seen it around quite a bit, and I think it's a very helpful tool to let us see what the different kinds of oils have and what they're made out of. So as you can tell here, anything in the blue is that omega-6, and there are certain oils like the sunflower oil and corn oil, soybean oil that tend to be a lot higher in those omega-6s. And you have olive oil, for example, that although it's not extremely high in omega-3, is mostly in omega-9, not high in saturated fats and not high in the omega-6. And that's why we do use and recommend olive oil so much. Now, certain oils like flaxseed oil, as you can see, is the highest in omega-3, and it is great. We encourage patients to have this in their salads, use it for salad dressing as well, just because it's really high in omega-3, but it is not great for cooking as it does not have a high smoke point. So if you have questions as to why we use certain oils and why we recommend certain oils, this would be why. Now, I get questions on coconut oil all the time, and well, it's okay to use, and again, that depends on a case by case. It is higher in saturated fats, as you can see. It's very, very low in the omega-6s, but it is high in saturated fats. And for some of you, that may be great. For some of you, it may be not. Same as palm oil. This is a saturated, whereas over here, you're seeing unsaturated fats more than anything. And you're seeing omega-3s more than omega-6s. Okay, so I wanted to discuss omega-3 and the research that is behind omega-3. I think omega-3s and heart health, maybe brain health behind that, may be the most studied in connection to those omega-3s, and for many good reasons. So there has been many studies that show improvement in modifiable risk factors, such as blood pressure, platelet reactivity, heart rate variability, vascular reactivity. So lots of research and improvement in modifiable risk factors it's a big deal, meaning that they have shown to help in these conditions. EPA and DHA may decrease dysrhythmias, sudden death, and rates of atherosclerosis, as well as slightly lower your blood pressure. So lots of good things there. In a study done, fish consumption may reduce mortality caused by coronary heart disease. And it was a study done, it's called DART. It is a developmental and reproductive toxicology study. It's a multi-generational study, and it reported a 30% reduction of acute coronary syndrome in patients randomly designated to consume fatty fish twice a week. So that's a 30% reduction of acute coronary syndrome by just eating the basic recommended 2 servings of fatty fish a week, the 200 milligrams of EPA and DHA combined that we just discussed. The Journal of Cardiovascular Pharmacology also did a study on trained healthy cyclists undergoing exercise to exhaustion. And we're taking about 8 grams of fish oil per day for about 8 weeks. They had found that they had lower heart rate, lower whole body oxygen consumption, and lower heart rate pressure. So it indicated oxygen utilization was much better in those cyclists than in the others that were not given the fish oil for those 8 weeks. So lots of great connections between omega-3s and heart health. There's lots of benefits to that, and there's tons of research out there. Like I mentioned, omega-3s and brain health are being studied a lot right now and they're finding really good things. DHA is concentrated in the brain, a total lipid content of about 60%. So DHA makes up about 10 to 14% of those total lipids or total fats that are in your brain. That's quite a good amount. In fact, I believe 8% of your brain's weight may actually be DHA. So that is a significant amount of DHA that is found in our brain. DHA readily crosses our blood-brain barrier, and it plays a critical role in neuron size, in neurogenesis, meaning the production of new neurons, in neurite growth, synapse formation, and function. And it is playing a crucial role in neuronal integrity, gene expression in the brain, and glucose transport, as well as cognitive development and learning ability. There is research showing improvement in cognition and memory with the use of DHA. So this is huge with the growing number of patients that are experiencing cognitive decline, Alzheimer's disease, and so much more. There's ongoing research about the ability of DHA to be able to help with that cognition and memory. There's also research on omega-3s and mental health. So there is research connecting omega-3s with helping ADHD, major depressive disorder, as well as bipolar disorder. Or independent meta-analysis of controlled trials in patients, in humans with major depression and bipolar disorder found a significant benefit from omega-3 acid treatment. So they are definitely utilizing them and testing them, and they have seen positive effects of omega-3 on bipolar disorder and major depressive disorder, which is huge. It's a great way for us to be able to help with those, and for those patients that do have them and could use some help in there. Right. Now, there are benefits of omega-3s in pregnancy, babies, and eye health. So DHA is not only concentrated in the brain, but it is also concentrated in the retina of the eye. Um, so a randomized controlled trial was done, and subjects with dry eye syndrome actually showed improvement in clinical markers of dry eyes with the intervention of omega-3 fatty acids. So not only is it helping with brain health, but it is also helping with your eye health, and that has to do with DHA being concentrated in that area as well. Um, DHA and omega-3s in general can support eye and brain development in babies. So during pregnancy and lactation, even with babies born, there's an intense mobilization of those polyunsaturated fatty acids for the synthesis of fetal and infant tissue. So lots of omega-3s are being utilized during that time. Again, the brain and the nervous system are going to be benefiting from all of the omega-3s in the body. There is a correlation between low birth weight in babies and low intake of omega-3s. So it's been shown in studies that it is affecting babies quite a bit. There's also a study done in 2015 by the American College of Neuropsychopharmacology, which showed a study done in boys ages 6 to 12 years of age. And that study found that in boys with or without ADHD, there were that had lower plasma total omega-3s. They found an increase of behavioral problems, learning problems, and health disturbances than those that had higher levels of omega-3s. So not only is it important during pregnancy as the baby is growing and developing, but also it's been shown to help with behavior and overall health in boys and the later age between 6 and 12 was for this study. So huge research discoveries found in relation to omega-3s. And so I wanted to point out some of the huge benefits of omega-3s and why it is that we need them. Not only are they essential, but knowing why they're essential and who would benefit from them, which would be everyone, especially those who are pregnant and for babies and growing children as well. Now, we talked about where EPA and DHA come from. They come from usually marine organisms. We talked about fish and algae, so we know where they come from. However, even though fish and fish oil are very high in omega-3, most of them, or some of them are, and we know why they're needed for our health, there is a large growing concern about the level of mercury and the amount of mercury found in fish. So methylmercury is most commonly the type that is found in foods, and it is readily and easily absorbable or absorbed in your gastrointestinal tract. So it's absorbed. About 95% of consumed methylmercury is absorbed in your gut. And of course, we know it can enter your blood cells and it can enter your brain and cause so many issues. Mercury toxicity has many different side effects, but even if some enters the body, it's not ideal. It's getting into your blood cells and into the brain and can cause some issues, even if it's a smaller amount. So we are concerned with the amount of mercury in fish. Fetuses are most at risk. If they're exposed to mercury, it can adversely affect their growing brain and their nervous system. So we want to eat fish because of the benefits that they have, but we do want to avoid fish that are high in mercury. So the bigger the fish, the higher in mercury it would be. So when selecting what fish you want to eat, the smaller the better. And that's because when the bigger fish eat the smaller fish, the predators, the bigger fish that eat the little ones, also absorb the prey's contamination. It's called biomagnification. So bigger fish kind of take over what the little one has eaten, and the mercury levels rise even more. The EWG, or the Environmental Working Group, is a great resource and has this image on their site. So you can see that there are fish that are going to be best to consume. They are very high in omega-3s. They are low in mercury and also sustainable. These are the fish that we encourage you to have at least 2 times per week to get to those at least those 250 milligrams that you need. So that includes salmon, sardines, mussels, rainbow trout, and Atlantic mackerel. Some of these a little bit more easily found than others, but definitely going to be on the more sustainable side and especially high in the omega-3s. Now, there are some that are good choices. They're high omega-3 and low mercury. They may not be as high in omega-3, but they still have some. That includes your oysters, pollock, and herring. Now, the fish that we have been wanting to and need to avoid, especially for those who are pregnant, would be the larger fish, king mackerel, marlin, orange roughy, shark, swordfish, and tailfish. If you want, take a screenshot of this, or you can definitely go into the EWG's website, and they even have a more extensive list of fish. So if you are at a patient recently that is going on a trip to Florida and loves to buy some fish, well, they are there, and I definitely provided them with the EWG website because there was a few of the fish that we were unsure about, and that is a great resource to look up all the fish that you commonly like or want to buy. And if you have questions as to something you're having regularly or want to have, maybe it's at a restaurant or you are traveling, it's a great place to look because it tells you how often you should be consuming this fish, how much mercury they may have, and how sustainable they are too, which is really important as well. So now what can we do? What are some action items? What can we start with today? Because I love nutrition in a sense that you're in control of it. You can, the things that you do can upregulate or downregulate your genes. There is control in what you can do in terms of your health, and nutrition is part of that. So I wanted to give you some action items, things that you can start thinking about doing today, and it's going to come to no surprise to any of you, but my number one recommendation would be to eat fish high in omega-3, low in mercury, at least 2 times per week. I probably sound like a broken record by now, but it is hugely important. And while we all for the most part know this recommendation, I have noticed that there is difficulty in doing this every week. I've noticed that it is not often prioritized, and if it's not intentionally done, it will not happen. And so there are many patients who know that they need to do this. However, week after week kind of forget to do it or are not as intentional about it. So I really, really would like for this to be something that we are consistent with. It is needed. It is essential. If we do not eat it, our body does not produce it. So that would be my number one recommendation here. Now, you can also, and I know you're a Maxwell Care patient, you probably have gotten your omega-3 and omega-6 levels tested. And again, we want to do this because that way we can better make a supplement recommendation and or dosaging in terms of whether you need more or less of those omega-3 supplements. So we do what's called an omega quant, and that test, as you can see in the picture, will tell you your omega-3 index. And that, similarly to your A1C, is the average of your blood sugars in the last 3 to 4 months. With the omega quant, it's the average of your omega-3 in the last 3 to 4 months. And so we can check whether your omega-3 is in a low level or if it's like Jane Doe over here, a desirable range, and whether you need to supplement more or less. Like I mentioned earlier, we do also check for your omega-6 and omega-3 ratio, as well as your AA to EPA ratio, and even with omega quant can check the trans fats as well, the amount of trans fats that we're eating, which should be very, very low. So getting them tested is important because that way you know where you are, how much you need to improve, and or what your supplementation needs are. Taking an omega-3 supplement as recommended. This is very important because there are some that do not like fish, that don't like the fishy taste of salmon or hate sardines or cannot stand seafood in general. If this is you, I highly encourage you to take your omega-3 supplementation very, very seriously. And that means continuing to take it as recommended by your clinician, not falling off of it sometimes, not skipping it for a month and going back for another, because like I said, these are essential. And if you're not consuming any of it, it is likely that your omega-3 levels are low, that your EPA level is low, and that your omega-6 is going to be higher than your omega-3. As we discussed, that can lead to inflammation. So we really, really want to increase that intentionality about taking that omega-3 supplement. If you're vegan, this would also be for you as well. I know that you won't be consuming fish, therefore supplementation is important, and there are vegan omega-3 supplements as well, of course, that would come from algae most likely. Now, reducing omega-6 consumption. This is for those who are unable to get omega-3s and that are dependent on the supplementation. By reducing, I don't mean eliminate or completely avoid. It means continue to be mindful of how much of that you're having, perhaps not using soybean oil, but substituting it with flaxseed oil in your salad dressings or olive oil when you're cooking. So I do not want us to avoid omega-6s, but I would like for us to reduce them, especially if you're unable to increase omega-3. If you are eating fatty fish and you can eat fatty fish at least 2 times a week, maybe you're getting fatty fish 3 times a week, you may not need to reduce your omega-6 consumption. Now, I don't expect that to be high either, but you may not need to intentionally try to lower it even more. Now, increasing your ALA. So that means your flax seeds, walnuts, chia seeds, soybeans are all going to be high in the alpha linoleic acid. Now, like we talked about, the conversion rate is quite low from ALA to EPA and DHA, but it does happen. And as long as we continue to have those healthy fats, not just the fatty fish, but those healthy fats, there is still some conversion to EPA and DHA. So I would encourage you to continue to increase them and have them. They have good benefits as well. So it's not that we just need EPA and DHA. ALA is also important. Like I mentioned, it is used for energy in your body as well. And with conversion being there, maybe trying to increase it, especially if you're dependent on supplements and not able to eat fatty fish at least 2 times a week. Any questions? I hope this was helpful. Let me know if there's any questions in the Q&A box. If there's any concerns, you need me to go back to any slides for screenshots. So the EWG website, you can find that one just by looking EWG seafood guide on Google, and that would probably be on the top ones that would show up, or just go to ewg.com, and they do have tons of other things that they work on, not just the seafood, but that list is there. If you would like to send a message to your clinician, they will absolutely send that link to you. Thank you guys so much for joining. I really, really hope this was helpful for all of you. This is a subject I'm passionate about because I get to talk to you, most of you, about it. Any of my patients have probably heard me talk about this. So I'm glad I was able to share with all of our Maxwell Care patients. You guys have a good rest of your evening. See you soon.